Genetic tests are medical tests that analyze a person's DNA to identify changes or variations that may be associated with certain genetic conditions or diseases. Genetic tests can provide valuable information about a person's health risks, disease susceptibility, and potential response to treatment. Genetic tests are used for a variety of purposes, including diagnosing genetic conditions. Genetic tests can be used to diagnose genetic conditions, such as cystic fibrosis, sickle cell anemia, and Huntington's disease. Genetic testing can identify the specific genetic mutation that is causing the condition and can help to confirm a diagnosis. Assessing risk for genetic conditions. Genetic tests can be used to assess a person's risk for developing certain genetic conditions, such as breast cancer, colon cancer, and Alzheimer's disease. Genetic testing can identify genetic variants that increase a person's risk of developing a particular condition and can help to guide preventive measures. Predicting response to treatment. Genetic tests can be used to predict a person's response to certain medications or treatments. For example, genetic testing can identify genetic variants that affect how a person metabolizes certain drugs, which can help to optimize treatment and minimize side effects. Types of genetic tests. There are many different types of genetic tests, each designed to analyze specific genetic information. Some of the most common types of genetic tests include single gene tests. Single gene tests analyze a single gene to identify specific mutations that are associated with a particular genetic condition. Single gene tests are often used to diagnose genetic conditions that are caused by a single gene mutation. Panel tests. Panel tests analyze multiple genes at once to identify mutations that are associated with a particular group of genetic conditions. Panel tests are often used to assess risk for complex genetic conditions, such as cancer and heart disease. Genome-wide sequencing (WGS). WGS analyzes the entire genome to identify genetic variants that may be associated with a wide range of genetic conditions. WGS is often used to identify rare genetic mutations that may be responsible for undiagnosed genetic conditions. Procedure. Genetic tests are typically performed using a blood sample or a saliva sample. The sample is sent to a laboratory for analysis. The laboratory will extract DNA from the sample and analyze it for specific genetic variants. The results of the genetic test will be sent to the doctor who ordered the test, who will then discuss the results with the patient. Preparation for genetic tests. Genetic tests do not typically require any special preparation. However, it is important to discuss the potential risks and benefits of genetic testing with your doctor before undergoing the test. Your doctor can also provide you with specific instructions on how to prepare for the test. Results. The results of genetic tests can take several weeks to months to be available. The results will be sent to the doctor who ordered the test, who will then discuss the results with the patient. The results of genetic tests can be complex and may require interpretation by a genetic counselor or other healthcare professional. Risks and complications. Genetic tests are generally safe procedures, but as with any medical procedure, there are some potential risks and complications. These may include psychological distress. Genetic testing can raise emotional and psychological concerns, especially if the results indicate an increased risk for a serious genetic condition. Privacy concerns. Genetic information is highly personal, and there is a risk that genetic information could be used to discriminate against individuals or their family members. Insurance discrimination. Genetic information could be used by insurance companies to deny coverage or increase premiums for individuals who are at increased risk for certain genetic conditions. Conclusion. Genetic tests are powerful tools that can provide valuable information about a person's health and genetic risks. Genetic tests can be used to diagnose genetic conditions, assess risk for developing certain diseases, and predict response to treatment. However, it is important to discuss the potential risks and benefits of genetic testing with your doctor before undergoing the test.